Hi everybody, so today we're talking about high blood pressure, and basically what blood pressure is just the pressure of circulating blood against the walls of blood vessels. So basically it's a measurement of that. Now there's two parts to blood pressure. We have the systolic part, okay, and systolic, I'm going to put BP for blood pressure. Systolic blood pressure is a measurement of the amount of pressure that's being exerted when the heart beats. So this is a measurement of when the heart beats. And then the next part is known as the diastolic blood pressure. And this is basically how much pressure would be in those arteries between the beats. So this is between the heartbeats. Blood pressure gives us an idea of how hard the heart has to work to get the blood around the body. So you might have heard before, people say, oh, my blood pressure is like 120/80. What does that mean? So let's say somebody says their blood pressure is 120/80. The top number is the diastolic. So that's the pressure when the heart beats, right? So the top number is the systolic. So this is the pressure when the heart beats. And then the bottom number would be the diastolic. Okay, and again, that's the pressure between beats. Okay, so that's what blood pressure is. This is the measurements that we look at. So let's go ahead and look at high blood pressure. So now, like we said, there's two parts to blood pressure. There's systolic, and then there's diastolic. Okay? If we look at a normal blood pressure, what would happen is my systolic, which remember, systolic is the number that's on top, this is when the heart's beating, would be less than 120 millimeters mercury, okay, to be normal. And my diastolic has to be less than 80 millimeters of mercury. Okay, that's a normal or a good blood pressure. It's elevated when my blood pressure here is between 120 to 129 millimeters of mercury, and my diastolic is still below 80 millimeters of mercury. Okay, so that's basically now we're elevated. Normally, if someone gets an elevated blood pressure, they are actually going to end up getting high blood pressure. So let's take a look at high blood pressure. HBP stands for high blood pressure. This is high blood pressure stage 1. Okay, my systolic now is going to be between 130 and 139. Okay, it's no longer and, it's now or. Or my diastolic, remember that's between beats, is going to be between 80 and 89. So what's happening here now is the heart's not getting the amount of rest it should between beats. Okay? So now, what's going to happen now is that we have high blood pressure, stage 2. Okay? In this case, we are going to have this be greater than or equal to 140 millimeters mercury. So you can see we're starting to get pretty hard beating heart there. Or this is going to be 90 or higher. Okay, and that's in stage 2. And then finally, in the last stage, we have something we call hypertensive crisis. So in a hypertensive crisis, this person needs to get to the hospital right away. Okay, they're close to dying if they don't. And in this case, this needs to be greater than or equal to 180 millimeters mercury, or greater than or equal to 120 millimeters mercury in diastolic. So if we take a look real quick at blood pressure, and we look at hypertensive crisis, you can see this is 120. Well, 120 on systolic, when the heart's beating, is considered elevated. So that should tell you right there how serious this condition is. Your heart and your blood vessels, the pressure inside of them is about equal to an elevated blood pressure right there. So let's take a look at some causes, and I'm not going to go into all the causes of high blood pressure, but just some things that can happen. So you can have a hypersensitive, sympathetic nervous system. I'm not going to spell nervous system, I'm just going to put NS. If you recall, the sympathetic nervous system is responsible for your fight or flight response. So in this case, it's hypersensitive, so the sympathetic nervous system is basically kind of overreacting too much. One of the things that can cause this is stress. When someone's under stress, the sympathetic nervous system is basically working overtime. So let's look at the effects of this. What can happen is, if you have a blood vessel, and you actually have the nerves from the sympathetic nervous system, they're going to come out of the spinal cord, and they're actually going to attach to the outside of this blood vessel. And what will happen is, when you're under stress, or when the sympathetic nervous system is working, they will release something called norepinephrine, and what that will do is that will decrease the size of the blood vessel. So now that the blood vessel's decreased in size, you're trying to get the blood through this blood vessel. So it's a smaller area. That increases the pressure. Okay, that's going to increase the pressure. So let's take a look at what can happen here, though. So let's just say this is my blood vessel, and it's been decreased in size. I'm just going to draw it big, but imagine this is my blood vessel, and it's been decreased in size, like I just said. In your body, in your blood vessels, you actually have nerves. You actually have cells that line the blood vessel. Okay? And these cells are actually called endothelial cells. They're called endothelial cells. And what they do is they make the inside of the blood vessel slippery. Okay, so there's less resistance. It means blood has less friction to flow through, right? I only have them written right here. Now remember, a blood vessel is like a round tube. So if I were to draw these, I should actually draw them up here and all the way around in this round tube. Okay, so, but I'm just doing them right here just because it's simpler. So when you have high blood pressure now, what's going to happen is blood is going to come in and it's going to hit against these endothelial cells, or the endothelial lining that's right here, and it's going to damage these cells. So instead of these cells being a nice, tight, and resistance to flow, what's going to happen now is they are going to become damaged. Okay, so now I've got my damaged cell. When this occurs, your body looks at this like the same way it looks like a cut on your skin. It's going to lay down basically a scab. I'm going to end up with scar tissue here. Fibrin and platelets are going to come to the area. So now I get my fibrin and platelets building up here. All right, and what's going to happen now is, instead of this being nice and smooth on the inside, now you can see I've got pieces that things can catch on to. So let's say I get my cholesterol building up here, and it gets caught on here, and now I start to get atherosclerosis. All right, let's put a lot in there. Okay, so now I can get a condition called atherosclerosis. All right, so there's my atherosclerosis. So now, what's going to occur now with the atherosclerosis is, now when blood comes in, normally blood that would just flow right over the blood vessels that were there, the endothelial cells that were right there, now are hitting this, right? And they have to go over it. So that's going to actually cause some resistance. Not only that, but you can see right here, I don't have as much room to go through this area either, for the blood to go through this area. So it's going to increase the blood pressure even more. Now, when that occurs, a few things can happen. A piece of this atherosclerosis can break off, go somewhere else in the body and cause an embolism, which can lead to a stroke or a heart attack. I can also get a piece of this breaking off, and like we saw in the myocardial infarction video, that causes the blood vessel to constrict even more. It causes more platelets to build up, and I can have a heart attack. And we'll get more into heart attacks in a little bit. The other thing that can happen is because the blood needs somewhere to go, what it actually does is it starts pushing down on these areas here and on these areas here, right? Because if I hit this and go up, right, and it can hit up in these areas, it will damage those endothelial cells too. It can weaken the lining, and then I can get something called an aneurysm. Okay, so I can get an aneurysm in here. Okay, which is like a bubble that's on the skin. So I can get an aneurysm in there, right? And then the bad thing is this can continue to grow, and if it's in a big artery in the body, it can actually bust this blood vessel open and again lead to something like a heart attack or a stroke or some other type of condition. Okay, so there's some problems that can occur from having high blood pressure. The other thing that can cause high blood pressure is if people have a high salt diet, right, they retain sodium chloride, which is salt. If they retain too much sodium chloride, what can happen is the sodium chloride will lead to an increase in the amount of fluids that are retained. Well, those fluids now have to be pushed around the circulatory system. So the heart has to work to push this around. It puts more pressure on the blood vessels, and it leads to an increase in blood pressure. So that's another thing that can actually cause, another common cause of high blood pressure. So let's go on and look now at what this can do to the heart. So if we draw a picture of the heart here, okay, here's my heart, all right? And in the heart, you have chambers. And in my heart, wait, let me just make this a little bit darker. So in my heart, we have chambers, okay? Blood comes into this chamber here. It then goes into this chamber here, which is called the right ventricle. This is the right atrium. From the right ventricle, it goes out to the lungs. Then it comes back into here in the left atrium. Then it goes into the left ventricle. Now, for the most part, the left ventricle has a wall, or has muscle, a thicker layer of muscle than the rest of the heart, because the left ventricle has to pump blood out to the body. So there is our left ventricle. This is the muscle that's right here, and this is a normal sized heart. What happens then is normally inside the heart, we have arteries that are in here, and those arteries are going to supply blood to this muscle that's in here. So let me see. So there's an artery, there's an artery, there's an artery, there's an artery. Okay, and so it's going to supply blood to these muscles. And hopefully these up here you probably can't see too well, but it's going to supply blood to those muscles. As you have high blood pressure, the heart has to work harder, and as the heart works harder, just like any other muscle in the body, if you work out, it gets bigger. So the heart's going to get bigger, a heart muscle on the left ventricle. And when the heart muscle gets bigger in the left ventricle, we actually call this left ventricular hypertrophy. Okay, that's an increase in the size of the heart muscle on the side. Now, if you notice though, you can see here with my arteries, they're not getting all the way to this new muscle. Okay, they're not getting all the way to that new muscle. So therefore, what happens is the heart becomes more stiff. The heart becomes stiff. Okay, because the muscle out here is not getting the proper amount of blood supply. The other thing you'll notice is this is the chamber that was pumping blood, right? It's gotten a lot smaller. Well, the heart still needs to pump the same amount of blood. So what's going to happen here is the heart is going to have to beat more often. So I get an increase in my heart rate. Okay, and because I get an increase in my heart rate, that's actually going to lead to a higher blood pressure also. So eventually, what's going to happen with the stiffness and the increased heart rate is the heart can't keep up, and it can lead to a myocardial infarction, also known as an MI, more commonly known as a heart attack. So let's talk about the symptoms of high blood pressure. For the most part, the symptoms of high blood pressure are none. And that's why it's called the silent killer. Because a lot of times, the first symptom people will have is the heart will give out and they'll die. So that's it for high blood pressure.